A shortage of a key medical component is causing delays for crucial imaging tests for hospitalized patients. The depleted supply of contrast material, a dye used to highlight different structures on medical scans, is leading to rationing within hospitals. TV5's Kendall Keys reports how the shortage is now affecting a local medical center.
This is the most major thing, obviously, the imaging, because there's just things out there, exams, disease that absolutely needs contrast.
Contrast material is a medical dye injected into patients during CT scans and MRIs. It's critical in assisting doctors to properly read the results and make diagnoses.
There are times when it's absolutely needed.
But getting the dye is becoming increasingly difficult because of COVID. GE healthcare factory shutdowns in Shanghai, where a large supply of the ingredient is made, is causing a severe shortage of the critical product. My Michigan Health in Midland uses an agent manufactured by Baracco Diagnostics, so it's been relatively immune from the shortage for now.
Because of the unprecedented demand, the supply chain is kind of shifted, and Bracco is just trying to meet the demand. So they have taken measures to make sure that they're going to have enough supply.
Mike Vanderpool, the manager of imaging services at My Michigan Health in Midland, says Baracco is pulling back on the monthly inventory the hospital receives.
They're looking at cutting this back about 10% of our contrast that we normally would be allocated.
Vanderpool says My Michigan Health is tweaking the way it handles its supply. Things like adjusting doses given to patients, asking providers to consider studies that don't require or require less contrast. He says it's even considered partnering with pharmacies to repackage some of the contrast to make it last longer.
We're just making sure that, a month from now, we're not in a position where we have to pull back on contrast for people who actually need it.
In Midland, Kendall Keys, WNEM TV5.